The conventional role of autologous stem cell transplant in Hodgkin lymphoma is as what we would call as salvage therapy. So usually Hodgkin lymphoma is a disease that has a good prognosis. Most of the patients that are treated with the conventional first-line treatment, they get cured. But then patients that relapse, at least until now, the best treatment that we knew of was to give patients a second type of chemotherapy and then to consolidate that treatment with an autologous stem cell transplant, which in a way is a fancy term just to describe high-dose chemotherapy. And the reason why we need an autologous stem cell transplant is that you're giving such high doses of chemotherapy that the bone marrow of the patient will not be able to recover on its own. And so you just supplement that chemotherapy treatment with the autologous stem cell transplant. There may be some changes in the immune system that you may be causing by resetting the immune system by giving the autologous stem cell transplant, but we think that most of the benefits comes from allowing us to give higher doses of chemotherapy so that you can maximally eradicate the tumor that may be left in the body, and so potentially cure patients that way. Now there's so many different drugs, so many different classes of drugs, even not just conventional chemotherapy. We talk about CAR T cells, and there's even talk about bispecifics for some of these proteins that are expressed by Hodgkin lymphoma, that it's unclear what the role of autologous stem cell transplants in Hodgkin lymphoma is going to have. We've already shown that some CAR T cells actually may be more useful for non-Hodgkin lymphomas in the setting where we use usually autologous stem cell transplant as the standard of care. And so it is possible that in a few years we'll drop autologous stem cell transplant as also a standard treatment for Hodgkin lymphoma, as long as we find other classes of treatments that can actually work better in that setting. But for now, it's still not off the table. It's still being used for sure.